Hello, I'm Dr. Jessica Evert, the Global Medical Director of Child Family Health International. I wanted to touch base today on one of the foundational approaches of CFHI's Global Health Education programs. CFHI utilizes a version of asset-based community development called asset-based community engagement. Asset-based community development was formalized at Northwestern University in the 1990s, and it has us challenge traditional notions of development where places that are resource restricted or deprived are looked at from a deficit lens, meaning that many people think they need to do a needs assessment or find a problem and suggest solutions. While this psychologically is a very natural approach for our minds, it actually has very negative consequences. When we look at a place that appears less well off or less developed, quote unquote, than what we're used to seeing, and we look at what's going wrong, we tend to miss a lot of the authentic realities, the story, the progress, and the power of people and places. So we don't want to do that because that will reinforce colonial narratives, it will reinforce pity, it will reinforce stereotypes about places that are economically not as well off. So how do we approach this? Well, asset-based community development and asset-based community engagement gives us another way to do so. Instead of looking at what's going wrong, we look at what's going right. Instead of looking at weaknesses, we look at strengths. Instead of looking at deficits, we look at assets. So let's talk about how we do that. Asset-based community development informs our engagement approach at CFHI. So our local teams, who are local leaders in both the health sector and other sectors, are able to map out the strengths of their health and social service systems. And then those strengths are what is emphasized in CFHI immersion programs. So students and young professionals get to go into communities and look at what is going well, at the strengths, which might be institutions, they might be associations, they might be the built environment, they might be commerce or things that are traded or valued, and they may be individual people. And so by understanding those strengths, outsiders can convene the assets within a community to build a shared agenda for how things can evolve and become even better. This also has the impact of changing our narratives so that outsiders, who are often from majoritized dominant groups, are able to more clearly understand and confront our biases about places that look, feel, smell, and operate different than we're used to. Many of those places in the global context are in low middle income countries. And oftentimes those that are traveling to low middle income countries under the auspices of global health are from high income countries. So it is very easy for those people from high income countries to have biases, to have superiority complexes, to have challenges with humility, and challenges really understanding reality in all its breadth and depth. So at CFHI, we utilize asset-based community development and engagement as a framework for our immersion programs. Our local teams are those that are mapping assets and allowing participants to immerse themselves within organizations and alongside professionals and community members that are efficacious for addressing health disparities, access, and human rights. So join us, consider using asset-based community development and engagement in your global health work, and learn more about how you can participate in CFHI immersion programs in 10 countries to understand asset-based engagement and to live and walk our talk. Thank you.